July 1st that we will no longer be carrying the Medicare supplemental coverages. One of the main reasons that we're no longer going to be covering it is the main group, which would be the employees and the early retirees, are moving to what's called a fully insured plan, which basically means the district buys a plan and United Healthcare will do the funding for the claims. Whereas previously, we were self-funded, where the district funded all the claims. What that does then is our Medicare retiree plans have to remain self-funded. They can't follow with the fully insured plans. And so that leaves a much smaller group. And I'd say within the last 2 years, we've probably had 4 people that have come on to our Medicare supplemental plans. And so with not very many people coming onto the plan, it's just not self-sustaining. And so the claims themselves would just be too much for the district to bear because there wouldn't be extra revenue coming in with the newer people. We're finding from those that have actually contacted me that they are able to find plans at a really good rate compared to what we had, because we've had to continually raise our rates. There's actually some better rates that could be out there for you. I'm going to go ahead and kind of move on to these so we know what we can do going forward. Chris Kupta, did I say it right?
You did.
She is a SHIP counselor with the Sioux Aging, and she's going to kind of walk you through some of the steps. Thank you.
All right. I'm mic'd, so that should help with people hearing. I'm the Director of Advocacy and Community Relations at Sioux Aging Services. We're located at 23rd and Pierce, kind of halfway between Green Gables and St. Luke's. Our agency works to keep people in their homes for as long as safely possible. So a wide variety of services, including education on Medicare. We do a monthly Medicare seminar. It's a 2.5-hour seminar. It's geared for new beneficiaries on the first Friday of every month. We call them First Friday Coffees. And there'll be a slide towards the end. You are more than welcome to come and join one of those to learn more about Medicare and to look at those options once again. We are going to go straight 2 hours. No breaks. We've got a lot of material to cover in that time period. So if you need a break, if you need to use the restroom, feel free just to get up and go. Just so you do know, the restrooms are down the hallway this direction and to the left. Okay, so that's where you find those. Well, we are, let me turn this on. We're here today because you got that shock and awe notice, right? And I'm sure that's what it was, shock. Maybe a little anger. I've had a couple people coming into my office. And change is inevitable, right? We don't like change, but it's inevitable, except from a pop machine. And that's when I get really angry, when it takes my change or takes my money and doesn't give me a pop and doesn't give me change. Okay, but that's nothing to what you're dealing with today. So, you will have the school's insurance all the way through the end of June. So if you have claims between now and then, they'll be covered. You don't need to worry about that.
What about pending procedures?
Okay. If you have anything that's pending, we want to make sure that you have the best option in place. And that's what we're here today for, is to talk about what those options are, what the cost of those options are, and the time frame you have to put them in place. Okay. I think the majority of you, unless you have very expensive medicines, will find that you're going to find savings because your policies with the school system have gone up very high. I was talking to one couple here, and they're telling me that the 2 of them paid $350 a piece for their supplement. And if we look down in the private market and we're glancing through their options for the age they are, we're looking at $200 a piece. So that's a savings of $150 a piece that could be applied to drugs if needed. So the majority of them is a good thing. Right now, you have 2 options. You have your F plan, or you have that F or that plus plan. The F plans are the same in the private market. There's no difference between an F plan. Your Plus plan adds some benefits like paying additional for your medicines. Unfortunately, there's nothing like that in the private market. You won't be able to replace those additional benefits, but you will be able to go to an F plan. So let's talk about those things. Siouxland Aging Services has two programs that work with Medicare. The first is our SHIP program, the Senior Health Insurance Information Program. Thank you, Harvey. And the second one is the Senior Medicare Patrol. The SHIP program is a volunteer-driven program, and even though I'm a staff member at Siouxland Aging Services, I'm considered a volunteer for SHIP. I also have 3 volunteers I supervise, including Harvey, who's back in the back rubbing his hands there and walking around because it's cold, because I sent him to my car because I forgot something. Okay? So Harvey's up there, and we're all glad to see you. So if you need a private appointment, don't hesitate to call and make an appointment, and we'll work with you one-on-one. Because today we're going to cover a lot of stuff, and that your heads are going to be spinning, I promise. Our Senior Medicare Patrol is an education program about Medicare fraud, abuse, identity theft, and the scams going around. And again, it's another volunteer program, and I try to cross-train my SHIP volunteers with SMP, but I have some specific people who only do SMP. So if you're looking for programs where you can volunteer and make a difference in the community and you find this interesting, come talk to us at the end. SHIP is a program that we receive our training from the Department of Insurance. We go through updates several times during the course of a year. The good thing about SHIP is we don't sell insurance. So we're never going to be pushing you into one plan or another, or one company or another. In fact, if you come to us and say, I want you to tell me which one I should take, our answer will be, here's some options. You know, here's the best 2 or 3. And what do you think about these? And we'll go through the pros and cons of each of those with you. Does that make sense? So we're unbiased in terms of what we're giving you with information. And we're never going to push you. The other good thing about SHIP is it's free. We all like free. Okay? Now, Siouxland Aging Services is a not-for-profit. Our majority of our funding comes from the state and the federal, and everybody knows what those budgets are doing these days. So donations are always welcome for the services we provide. Okay? So questions on SHIP? Does that look familiar? Feel familiar? This is one of my favorite cartoons. Medicare is a very complex system. A lot of ins and outs. A lot of difficult things to understand in Medicare, and some things we'll never understand just because it is Medicare. Anybody know how to get a hold of Medicare? What's the number you call? Take a guess. I heard somebody say something. 1-800 Medicare. It is 1-800 Medicare. You drop the E when you dial. 1-800 Medicare. They're open 24 hours a day, 7 days a week. So if you have that burning question you want to ask Medicare, and it's keeping you up in the middle of the night, that may be the best time to call. Anybody call Medicare during the day? I hear a chuckle. Have you called Medicare during the day?
I'm not on Medicare.
You're not on Medicare yet, but you might have called for your mom. Okay? You can be on hold forever. Let me tell you, that music gets very old very quickly. When I call Medicare on someone's behalf from the office, I put my phone on speakerphone and continue to work on multiple projects until someone finally picks up. Okay? Yes. So if you have a question that's just a general question, how a benefit is covered, if a benefit is covered, you can call outside of business hours. So the best time is before 7 and after 7. But if you have a question on a claim, on how they're paid for something for you, then you need to call during business hours, and you're going to have that wait time. How many people have their Medicare card in their pocket or their purse? Your Medicare card has a special number on it, your Medicare claim number. What is that number?
Social Security.
Social Security number. What happens if you lose your wallet or your purse? Someone has your Social Security number and you're a prime candidate for identity theft. So I'm going to tell you right now, take those out of your wallet or your purses when you get home and make yourself a certain wallet or packet to take with you if you're going to the doctor. Now, if you're traveling, take it with you as well. But if you have an emergency around town, they have to treat you. No choice. And they will ask you to bring that to them at a later time. And they're going to give you a time frame to get it to them, but don't carry that around. Your Medicare number is followed by a letter. That letter indicates who's earned that benefit. If you have an A there, that means you worked at least 10 years throughout your life, at least, okay? And it doesn't have to be consecutive. You worked at least 10 years, you've paid into those FICA taxes, okay, and you've earned the benefit. If you have a B there instead of the A, that means you're pulling it off your spouse's benefits. Okay, so I see a lot of women who are older and they didn't work outside the home. Okay, so they were pulling off their spouses, or they didn't work the 10 years outside the home. When their spouse passes away, they get another card. And that B changes to a D. D is in dog. Because now they're pulling off the death benefit of their spouse. Okay? If you get a change in cards, destroy the first card. Shred it up, get it gone. Okay? Only carry one card at a time. And you only carry it in that going to doctor packet, not in your wallet. Okay? Similarly, if you're carrying your Social Security card in your wallet, get that out of there. Put that someplace safe. It also tells you which of the benefits you have, A or B, and when they started. Now, another time you're going to need that card is when you come and see a SHIP counselor, because we have to have not only your Medicare number, but those effective dates. Okay, so when you make your appointment to come in, make sure you bring your card as well. Now, the next part of the presentation, we're going to be talking about Medicare. Specifically about the parts. We're going to review what each part covers, some of those little ins and outs, and then those pathways through Medicare. Most beneficiaries choose to go with Original Medicare. Original Medicare is run by the government, so you're using your red, white, and blue card when you go to the doctors. You have that A and B. You add to that your drug plan. And for you as retired teachers, you have the school's retiree plan. Okay, but you have a separate drug plan that each of you chose based upon your medicines. Now, you will now be looking at picking up a supplement instead of the school's plan. Okay. About 1 out of 4 people in the nation choose to go with a Medicare Advantage plan. That's a private option. What happens instead is Medicare figures out what they pay for the average beneficiary. They transfer that money to a company of your choice, and that company now administers your Medicare. So they tell you to put away your Medicare card and use our card instead. In Woodbury County, there are basically 2 companies that offer Medicare Advantage plans. Coventry Advantra and Humana. We're going to go through this line first, and then this slide will come back up, and then we'll go through Medicare Advantage and talk about the benefits and risks of Medicare Advantage. Okay? With me? Kind of, sort of. I know. This gets complicated here. Part A is typically your hospital or hospital-related care. Now, it's the one that's going to cover when you're inpatient. So it's always important to ask when you're admitted to the hospital, is this inpatient or out? Because what you pay or your insurance pays is based upon being in or outpatient. If you're outpatient, it's going to fall under your B. If you're inpatient and you get medicines in the hospital, they're 100% covered. If you're outpatient, your Part A or your Part B does not cover medications. So if you're in the emergency room and they need to give you 2 Tums, they can charge you $18 for those 2 Tums. And you get to pay it. Your insurance does not. Okay? If they give you a prescription medicine under Part B, outpatient, you can run it through your drug plan and you might get partial reimbursement. Okay? But inpatient meds are covered. It also is going to cover these other portions. We talked about having worked 10 years for Part A. Part A, again, if you worked that 10 years, does not have a premium. If you did not work 10 years and you do not have a spouse or someone else to draw that benefit from, you can buy into Part A. Now, Part A, and I don't know if most of you noticed, you do have a set of slides in your packet. You can take notes on those as we go. Totally up to you, or just follow along. So right now we're on page 4, the bottom slide on page 4. Okay, that hospital benefit is different from standard insurance, where you pay a deductible once during the course of the year, and then you're done with it. The deductible for Part A is based upon benefit periods, and benefits periods can happen more than once a year. So, I'm also going to have you refer to this book, the supplement guide. Has the big black cover on it, the big black rectangle. It's in your packet. It's in your packet. It's in your folder. If you turn to page 2 in that, it's one with the big black rectangle. It's one with the map and one with the rectangle. So if you are in the hospital, right here, 1 to 60 days, how much do you pay for deductible? That's exactly right, $1,184. That's your deductible, whether it's 1 day or 60 days, or anything in between. Okay? That's once you finish that hospitalization and leave the hospital, once you're out 60 days, that benefit period ends. So if you land back in the hospital on day 61 or beyond, you're in a new benefit period, and you get to pay that deductible again. If you land in the hospital on day 30, you've broken up the consecutive days. So your 60-day period scoots over, because you have to be out 60 days in a row. So I guess the moral of that is, go in the hospital infrequently or very often. Okay? Yeah, if you're in every month, every other month, you're probably okay. Now don't do that. That would be really disruptive for your life. Okay? We all have a life. Okay, but what I wanted to point out there is that deductible could hit you more than once in a year if you're out of the hospital 60 days in between your hospitalizations. Questions? Yeah, that's really weird. That's one of those things with Medicare. Who designed that? Okay? Legislators, that's exactly right. And they don't have to pay it. Okay, so that deductible is for 1 to 60 days. If you're in the hospital longer than 60 days, then you have a copay of about $300. If you're in the hospital longer than 90 days, Then you have 60 additional days that you can use once in your lifetime. You don't have to use all 60 at the same time, but they're a one-time usage. Now, what's the reality of landing in the hospital for 60 or more days? Pretty slim and none, right? It's going to be a pretty dire situation. Okay? Once you get past using those lifetime days, Medicare does not pay. Okay? But most of us will never get up to using those lifetime days, those once-in-a-lifetime days. Skilled nursing care is covered as a rehab benefit with that intent in mind, to get you rehabbed and back home. Okay? Medicare was never designed as long-term care, so this benefit is very limited. If you're in the hospital 3 days, 3 nights, not counting the day you're dismissed, then this benefit will kick in. Okay, and it's important to know about that 3 days, 3 nights, not counting the day you're dismissed. If you're in that time period and have to go to a nursing home for skilled care, then Medicare will cover 20 days with no charge. Okay? My mother recently had abdominal surgery, was in the hospital for about 10 days, was not strong enough to go home and needed that skilled care to get her back on her feet to be able to function back in her home. She was in the nursing home for about 15 days, okay, to get her strength back, okay? Covered 100%. Nice benefit. If you need more than 20 days, $148 a day copay. If you need more than 100 days, Medicare considers that as long-term care, and it does not pay any longer. Now, the important thing to know about this as well is that if Medicare doesn't pay first, neither will your supplement. That's currently true for you with your plans. Medicare has to pay first. Okay? The things that break my heart, I had a call from a woman up in Plymouth County. She had rotator cuff surgery, was hospitalized for that, and was sent to the nursing home for 6 weeks. She didn't realize that she needed that 3-day stay. The doctor kept her in the hospital 24 hours. She thought both Medicare and her supplement were going to pay for that nursing home stay. She had $6,000 in nursing home costs and only $7,000 in the bank.
So your goal is to stay in the hospital for free?
I'm telling you, if it's all possible, they have to be able to justify. You got to look at the doctors and nurses side and the hospital side as well. If they can't justify keeping you in the hospital, you're not going to get that benefit. But if they can justify keeping you there for some reason, and you're going to need that care, you may want to push for that.
Does that include the surgery day too?
Yes.
But not the dismissal day?
Now, unless your surgery would be outpatient surgery.
Oh.
Okay? If it's outpatient surgery, no. And my mother's a frequent flyer. I use her quite often as an example of what not to do with Medicare. She recently had some other smaller surgery, and they kept her overnight in observation. Okay, overnight. You're thinking, oh, she's got a room, she's got a roommate, should be inpatient, right? No, observation's considered outpatient. So how it all paid was different than if she had an inpatient procedure. Make sense? Kinda, sort of? Home health care is also covered after a hospitalization. And again, it's got to be very similar circumstances in that rehab, trying to keep you home, trying to keep you healthy, trying to reduce those costs. And again, it can bring in a wide variety of services to help you recover from your hospitalization. This is covered very well, again, for a period of time, that 100% coverage. I'm in your way, aren't I? I keep stepping right there. Just kind of shimmy one side or the other, okay? All right. It also will cover for some durable medical equipment following the hospital stay, where Medicare pays 80% of that. Durable medical equipment, walkers, wheelchairs, canes, oxygen, nebulizers, diabetic equipment, or the testing equipment, and the supplies that go with that, CPAP machines, okay, wound suction devices, all kinds of medical equipment to help you recover. Part A also covers end-of-life care, hospice. And a lot of people wait until almost too late to bring hospice in. But hospice can bring a wide variety of support, not only for the patient, but also for the family. And lots of times people are in denial on whether this really is getting close to the end. You know, just don't want to give up yet, and they think having hospice come is a give up, a surrender to that disease, and it's not. It's a nice support. And if a person gets better while on hospice, they can be dismissed from hospice. They can go on and off hospice several times. Again, a wide variety of supports during end-of-life care. Hospice also covers medications related to hospice, so that pain management, nausea management, again, a lot of the drugs. Now, if you have maintenance drugs, like if you take diabetic insulin or diabetic medications or thyroid medications, those are not considered part of hospice typically, so they're going to fall under your Part D plan. For the ones related to that management of the end-of-life care, yes, those will be covered by hospice. Hospice also covers for respite. Anybody here know what respite is? Yes, what is it? Rest for the caregivers. Absolutely. It's that break to bring somebody in to take care of your loved one, or to take your loved one to a facility that has specific respite rooms available so that you can have a short vacation or go to a wedding of a loved one. Okay? So it covers that with only a 5% copay. Now, Part B is your outpatient services. This is the one you're probably going to use more often. With Part B, this is your hospital visits, this is your emergency room care, this is outpatient services, this is your blood work, your CAT scans, your different kinds of tests that go on. This again covers durable medical equipment for most people. So again, I mentioned before, it covers diabetic testing supplies. So make sure that when you're picking stuff up at the pharmacy, they're running it through your Part B, not your drug plan, or making you pay out of pocket for those test strips and those pokers, lancets, right? Okay. This is the one that has a premium to it. Okay, $104.90 a month. That premium is tied to your Social Security. If Social Security goes up, so does your premium. If Social Security doesn't go up, neither does this. Okay? Back to one other point with the durable medical equipment. If a medicine goes into a piece of equipment, like a nebulizer, then it runs through your Part B. Okay? A lot of people, again, don't know that, and their druggists get by charging them the higher amount. Again, if most of us don't fall above this bracket, but if you do, you get to pay an extra surcharge. That surcharge is called IRMA, and IRMA's not a very nice lady at all. Okay? She wants more money. Most of us don't fall there. Most of us don't have to worry about IRMA. And she's really not a lady. It's just initials for some term. Part of healthcare reform has brought in more and more preventative services. That's one positive aspect of healthcare reform. When you start Medicare as a new beneficiary during that first year, you get a welcome to Medicare visit. Okay, it's not a physical because Medicare does not cover physicals. But it's that sit down, get the history, family history, how you're taking care of yourself, what chronic diseases you have, what kind of plan we need to put in place for the future. Every year following that, you have an annual wellness visit. And when you make that appointment, you need to say, I want to come in for my annual wellness visit. Some doctors do not do those. Okay? So you need to make sure you get in, and that's going to be a covered service for you. Again, it's going to be another sit down. How are things going? You know, how are you taking care of any chronic illnesses? What's your family history look like? They might do blood pressure and your pulse and your weight and your height, but not a whole lot more than that, okay, because it's not a physical. However, anything on this list here as a preventative measure is covered 100%. No deductible, no copay. So for people who don't have a supplement and only have Parts A and B, they can use these visits to the doctors as stepping stones to get the rest of that. So it's time to get your flu shot and you don't need anything else at the doctor's office, go in for your wellness visit if you haven't had it that year, and use that wellness visit as a stepping stone to get your flu shot for free. Okay, no cost. Make sense? Now there's also a difference between preventative health and medically necessary. Okay? So I'm going to pick on you since I keep standing in your way. Okay, is that okay? Okay. Let's say for you she's gone in and gotten your mammogram. Never a problem with the mammogram. And it's time to get it this year. It's preventive. So we're just always just double checking, making sure nothing's there. Okay? So if we can stay ahead of a crisis, it's going to make life better and save Medicare money. Okay? But let's say that she goes in this year and you find a spot, heaven forbid. Okay? Once they find that spot, it becomes medically necessary to do those mammograms to make sure that it hasn't grown and it hasn't become a problem. Medically necessary falls under the co-pays and the deductibles. So let's say 5 years ago you went in and did your colonoscopy. Oh, how nasty those are. Okay? And they found a polyp. And you go in to get your colonoscopy this year. It's medically necessary. You're going to pay co-pays and deductibles, or your insurance will. Okay? See the difference? Okay. Now, with Medicare Part B, it does have a deductible, and the deductible is annual, $147. That changes every year. 3 years ago, that deductible was $156. Last year it was $142, and this year it's up to $147. Don't ask me why it moves around. It's Medicare. Okay? Doesn't have to make sense. It just is what it is. Okay? After you pay that deductible, and someone asked me, do you pay that deductible to Medicare? No, you pay $147 worth of services. So you go to the doctor and you pay that first $147. Okay? Or your insurance does, your supplement does. After that $147 is paid, then it's typically that 80-20 split, where Medicare pays 80% and you pay 20%. And that's of the approved charges that Medicare sends out. So let's give an example. Doctor bills this young lady right here in the red $200 for seeing him. Okay? Medicare approves $100. How much is Medicare going to pay? $80, and what are you going to pay? 20. Got some math people in here. That's good. We like math people, right, Harvey? Okay. Now, you could have excess charges. There's that extra $100 hanging out there, right? So this is something you need to know and need to be asking. You need to ask all your providers, whether it's durable medical equipment, or the doctors, or the hospitals, is this term: do you take assignment? Taking assignment is going to save you money and save your insurance company money. And why would you want to save your insurance company money? Ask you guys over there. Yeah, it's going to keep your premiums lower. Okay? So if you ask if they take assignment, you're helping to keep your premiums lower. Taking assignment says the doctor agrees that what Medicare approves is payment in full. So remember the doctor charged $200, Medicare approved $100, $100 is payment in full. So Medicare pays $80, your insurance pays $20. Okay? If the doctor doesn't take assignment, then he can charge you 15% of that outstanding charge. So instead of paying $20, how much are you paying? 15% of that 100 hanging out there. $15 more, which is going to be $35. No big deal on that $100, right? But if you're in for knee surgery, and your knee surgeon and the hospital don't take assignment, that could be a nice chunk of change, right? And if it's durable medical equipment, that percentage goes up to 65%. 65. Now think about all those ads on TV, selling durable medical equipment, the diabetic supplies. Do you think they take assignment? No way. They're socking that extra 65% to your insurance company.
Can I ask you a question?
Yes.
We had some services done, and it was an outpatient, and we got our benefits papers back, and it says, you owe nothing, but we still got a bill from the hospital.
Come see me.
Okay.
I have some business cards back there, but I didn't give you one already. Make an appointment, we'll talk.
Okay.
Okay? Now, if the doctor doesn't take assignment or the provider doesn't take assignment, there's typically a couple clues. They give you a piece of paper and they say, this may not all be covered by Medicare, and you will be liable for the remaining charges, and you agree to pay those, and you sign it. Don't take assignment. Okay? Sometimes it's people behind the scenes, the anesthesiologist, the x-ray technician, people you really can't ask if they take assignment. Okay? If they don't take assignment, the Medicare is going to send payment to you. That's another good reason to read your Medicare summary notices. There could be a check in there. You don't want to throw a check away. I don't. Okay? And when you get that check deposited in your bank account, don't sign it over to the provider. Because Medicare is not going to give you a copy of that check if the provider down the road said you didn't pay that bill. Okay? So you want a paper trail on how you paid it. So put it in your account and then write or pay that bill so you have that paper trail. Okay? Questions on that? This is a quiet group. This is a way too quiet group, Stephanie. They make me nervous. It's almost like the high school boys. I had a lab class, and they were really, really super quiet, and the naughty class. I was a substitute teacher, and all of a sudden they moved to the back of the room, and I thought, well, they're still working. I'm not going to make a big deal. I walked by the science table they had. Kaboom! They had sat up there in the front and taken the screws off the table. Yeah. Yeah, it was scary. Okay, so with Medicare, you can go to any doctor who accepts Medicare. You don't have to have a referral. Okay, so my mother-in-law recently had some problems with her toe. We've moved her primary care doctor. She hasn't seen the new primary care doctor yet. Okay, and when it flared up, she says, I don't know what we're going to do. I can't get a referral to the podiatrist from the doctor that we just left. I said, you don't need it. Don't need it. We can call them straight. You don't like the answer the doctor's giving you and you want to go see another specialist? Go for it. Make that appointment. Call Medicare first to make sure you can have 2 of that kind of appointment in a year, but, okay, you don't have to have that referral. There are some programs out there to help people who are lower income, okay, and these are tied in with Medicaid, but they're above full Medicaid levels. So for people who are struggling with income and struggling to be able to pay that premium or to pay those co-pays, you know, get them over to us, we'll screen, we'll see if they're eligible. Now, Medicare doesn't pay it all. We know that they don't pay those deductibles. What was Part A deductible? Here's the quiz coming. Come on. 1184. 1,184 deductible. What is it for Part B? I heard it over here. 147. Okay. You have co-pays in the hospital. That's after day 60. Okay. For Part B, it's what percent? What's your copay? What is that? What is the split? Medicare pays?
20.
Okay, so it's 20% that you pay. Excess charges when doctors don't take assignment. And there's just some things Medicare doesn't cover. Things like dental. Darn it. They don't cover hearing aids. They only cover one pair of glasses when? After cataract surgery. So don't forget to get your glasses after cataract surgery. Now you only get a certain allotment, so you can't get the cataract glasses.
Are you talking about the frames or lenses?
Both. You get a credit towards both. Okay. So it's going to cover a very inexpensive pair. But at least it's a pair. That's the only pair that they cover. They don't cover Ted hose. You know, the support stockings? I call them old lady hose. Okay. Now, I have to tell you, I've worn them. So, yeah, I felt like an old lady. There's just some things they don't cover. So, if it's not covered by Medicare, remember I said about the supplement? The supplement doesn't pay either. But people buy supplements to cover these charges, everything except the green. Supplements in Iowa are standardized. There's 10 different standardized plans. As long as the plan has the same letter, it's identical no matter who sells it. That means an F is an F is an F is an F. No matter if it's AARP, Equitable, Continental Life, Wellmark, they're all identical plans, or the school F plan. They're identical. An F is an F is an F. So don't let an insurance agent come in and say, you know, my company has the best F plan out there. You can say, baloney. They're all the same. Okay? And there are some agents who will tell you that. Okay? An F is an F is an F. You have, yes, Harvey.
Be careful with that F deductible, too.
Yeah, there is a high deductible F, but what it covers is still the same as a regular F.
But you gotta pay, I think, $2,110 out of your own pocket first.
Right. The difference between an F plan between companies is what you're paying for it. Okay? So you can buy an F plan as low as $100 a month or less at age 65, and all the way up to almost $200 for the same plan from a different company.
But the coverage is the same.
Coverage is identical. That's what we're trying to say. The coverage is identical. Okay, the premiums vary. They also vary state to state. So is everybody in here from Iowa? Anybody in here not from Iowa? Okay, come see me afterwards because we have the number for the SHIP office
Florida.
in the other places.
Oh, that's really good.
Okay, so if you're not from Iowa, we have those contact numbers for you to get a hold of those supplement guides for your state. Now, when people turn 65, there is a 6-month period where they have what's called guaranteed issuance. If they do not get it during that time period, and we're going to cover that a little bit more thoroughly in just a moment, they don't get it during that time period, then underwriting comes in. And underwriting means they look at your health conditions and they base the premium on those health conditions. And the insurance company has also at that point, that later time period, the option to turn you down. So if you've had a stroke, if you've had a heart attack, If you had cancer within the last 5 years, they don't have to take you. Okay? So I tell people you want to choose very well when you choose your supplement. You choose your supplement like you choose a life partner, with the intent of staying with it for the rest of your life. So my mnemonic for this is you marry your supplement and you date your D. Okay, so we're going to talk about both of those. These are the 10 standardized plans. They're on page 3, I believe, in that guide. I set mine down. There it is. So if you can't see the chart, it's right here as well. You don't get all 10 plans. You don't get all those options, losing employer insurance. So we'll cover which ones you get in just a moment. But when we look at supplements, cost generally is based upon how much risk you're asking the insurance company to take on. Insurance is sold not based on risk, not on the goodness of the insurance companies. Okay, not of the goodness of their hearts. They don't sell it to you for that reason. Okay, so if you look at that chart, which one has the least amount of risk for you as a consumer? Which one has the least risk? Which one is covering the most for you?
Yeah.
An F plan. Which one do you think they sell the most of? F plans, because as we get older, we don't want to be playing with risk, right? Which one do you think is the most expensive? F, because the insurance company is taking on the risk, okay? Now, you have a guaranteed right, that guaranteed issuance, now that your insurance is ending with the Sioux City Schools. You have the choice, and you want to, in your book, circle these. You have a choice of an A, a B, a C, the F. And F also has a variation which has a high deductible, okay, and the K's and L's. So they can't sell you the G's in the end, okay? So of that choice, probably I would guess most of you are going to choose an F because that's going to be the most similar to what you had with the schools, or identical to what you had with the schools if you didn't have the plus plan. During this time of guaranteed issuance, the companies can't turn you away. They have to give you a policy. They can't be looking at your health conditions to base your premiums on. And they can't have you have a waiting period for any pre-existing conditions.
You're talking about because we're being dropped by the school.
Exactly. That opens up a small window of guaranteed issuance. Remember, I said new beneficiaries at age 65 have a 6-month window. Okay? And that's even true if you have somebody who's disabled before 65. When they turn 65, they get that same 6-month window. And a lot of people on disability don't know that, and they miss that window.
So this starts July 1st.
This starts July 1st. So your time of guaranteed issuance is 2 months. So you have to have your supplement in place and starting between July 1st to September 1st. You have 63 days. Now, for the most of you, you will want it in place and ready to start on July 1st because you don't want a gap where you don't have that extra coverage. So when you're talking with insurance agents, you need to be very specific. I want it to start on July 1st because my employer insurance ends on June 30th. Okay? Now, there's also a difference. Some people say, I'm going to get ahead of the game. I'm going to get my supplement to start on June 1st so I don't have to worry about it. You don't want to do that because you will not have this guaranteed issuance if you leave the plan early. You only get it when the plan leaves you, when it ends. okay?
Do you want it to start by July 1st?
Yes. So what you're going to do is start doing your research this month, talking to agents, getting some quotes, and by the end of May, you're going to be filling out those applications. End of May, beginning of June, you're going to be filling out those applications for that July 1st start. That's your time frame you need to stay with.
I said, excuse me, fill out applications. Can you find an insurance policy now, fill out the paperwork, and have them hold it?
You need to ask the agent if they will hold it until that July 1st start. Absolutely.
I have some big surgery ahead of me, should I be up front? What's the what's coming?
No.
Or should I be mom?
No, you should be mom.
Is that
They
mom?
cannot legally ask you health questions. They cannot be asking you to go have a physical. They cannot be asking for you to disclose your health history when they fill out those forms. Now, I understand they can ask 5 questions, and those 5 questions cannot be used to raise your rates. Those 5 questions are being asked to see if you qualify for premium rates that are lower. Okay, so they can ask, there's 5 questions, I think one's end-stage renal disease, and I don't know the rest.
Question, you said if you pick a plan, you plan on staying with it for life?
You should. If you're healthy, you can go looking for supplements later on. And if you can find a cheaper one, go ahead and switch. But for most of us, as we age, we start adding multiple health conditions. And remember, we talked about underwriting. Once you're outside that little 63-day window, they're going to underwrite any health conditions. If you have none, yeah, continue to look. If you don't, if you do have health conditions, stay with what you have. Okay? Oops, wrong way.
So now are they considered under the window because you're eliminating the policy that they're carrying?
That's exactly right. Yeah, that's exactly right. Your window is open for that guaranteed issuance just because your company policy is ending. And that window is very small, 63 days. Okay, so you've got to make sure you get in there when it's time. Okay? Okay, these are the ones that you're eligible to buy. Okay, so let's move into that book. Let's take a look at what those options are. If you'll take this book and turn to page 26. Your choices go from page 26 all the way back to page, I think I have this memorized by now, Harvey, 34. Yeah, you've got lots of choices. Isn't that nice?
No.
Oh, let me make it easy for you. Let me make it easier for you. Not easy, easier. Okay, let's take a look at the AARP plan on the top of page 26. Now, I don't have a preference for that, remember? I'm only choosing it because it's on the top of the list. Okay, as a shift counselor, if you come and say, which one should I take? We can't tell you that. Okay, so the AARP plan, notice in the age column, it's in 5-year increments. That does not mean the premiums only go up every 5 years. They go up every year. Every year. We just can't put them all in the book. They'd be monstrous. Notice that the premium increase ends at age 80 in our book. It doesn't end at age 80 for the policies. That was just a limitation of the researchers in putting this book together. Because most of the time when we work with new beneficiaries, they're age 65 to 70. Okay? So if you're older than age 80, you're just going to have to kind of ballpark it from what's in the book. The premiums will continue to go up. Okay, so if we look at a Plan F, this is the annual premium. So the AARP annual premium for a Plan F at age 65 is how much? $14.90. That's about $120 a month. Not too bad, right? Compared to $375 or $350. So if we look at that AARP plan at age 75, it's $23.55, almost $200 a month. Your current plan is running about $300 to $350 for a plan
Probably
F.
more coverage for that.
An F is an F. Now, if you have the plus plan, yes, you are getting a little bit more coverage, but not necessarily with the supplement. Your extra coverage is that wraparound for the drug. So if you have expensive drugs, again, that's where you may not come up with as much savings. Okay? Now, let's go down to the American Family Life Assurance Company of Columbus, AFLAC. Okay? How much is their premium at age 65? $13.46. Is there any difference between that AFLAC plan and the AARP plan
No.
and what they cover? Not a bit. Not a bit. But there's $150 of savings between the two plans. Okay? Let's flip over to page 28. Let's look at equitable. Premium is for 65? $12.50. Wow, just barely over $100 a month. 102. Not too bad, not too shabby. Look at that for that one for age 80. Under $2,000. That is the lowest one in the book this year. Okay, let's go back to Wellmark on page 34. Page 34. Premium at age 65, $14.51. That's right there in that ballpark, very similar to AARP. But notice the price at age 80. Current price at age 80. 26. Okay, the AARP at age 80, I'm going to flip back here real quick, was 23. $300 savings between the two, same plan. Okay, some people are very comfortable knowing the security of Wellmark, and they're willing to pay $300 extra for that. Me? I don't stand in the street and throw $300 down the street. Okay? Now, next question I'm going to get is, how do you know if a company is secure, if they're going to stay around? There's rating systems on the internet. So if you do Google searches, you can check for rating systems on supplemental plans. If you want to know how well it pays and how quickly it pays providers, call your doctor's office, talk to the billing clerk, ask them if they've heard of these and how well they work with them as a provider. Okay? That's totally up to you whether you want to go do that much research. Most people don't. Okay, let's go over to that notes column. Okay, on the far right-hand side, there's two columns there. The notes column. Okay, and notice there is a key towards the bottom of the page. The C stands for automatic crossover. That means when your doctor sends it to Medicare, Medicare automatically sends it on to that supplement. You want automatic crossover. There's a few companies like Everence Association that don't have automatic crossover. You're going to have to stay on top of your provider to make sure they're sending it to both Medicare and then to your insurance. Okay? And this is another reason that if you do down the road change your supplement, you want to call Medicare to let them know you've changed supplements so they get the crossover correct. Okay? So that is one time you want to call Medicare yourself. Okay, the second one down has an NA, IA, and AA. See that in those? AA, in the notes column, there's a C, and then there's either an NA, AA, or IA. I'm on any of the pages with guide.
I guess I didn't see the NA is what I was.
If you go back to that AARP plan, they have an NA.
All right, got it.
Okay, AA means their premium is based upon your attained age. Last September, my mother called me and said, Chris, I can't believe it, my premium went up again. I said, Mom, you just had your birthday. Okay, so some of them do it in the month of your birthday, some of them do it the first of the year, some plans do it on the anniversary when you picked up your policy. But you're going to have one rate increase every year. Pretty much count on it. The company, though, can ask one other time during the year if they can justify it and be approved by the state insurance department for a second increase. It doesn't happen often, but it is possible to have 2 rate increases in 1 year. Doesn't happen often. Rate increases are across the board. So if they're raising your rate, they're raising your rate the same amount. Okay? They can't raise your rate based upon your health. Okay? It has to be even through all the clients they have. Okay? The NA means it's not based on their age. So if I'm looking at AARP plan and I see there's an NA there, what's one of the questions I'm going to ask the insurance agent? Yeah, how are you basing your premium increases? What's it based on? Why are you raising it? You know, are you raising it on the number of claims that come into the company over that year? Are you basing it on inflation? Are you basing it on my health conditions? No, they can't do that. You already know that.
Why did I hear so many negative comments about art?
I can't answer that question. I can't answer that question. Because a lot of people don't like art because of politics, I think, that they're involved with. But they work with United Healthcare, if you look down here, as well. So, okay, let's go back to that. IA means it's based upon your initial enrollment. So if you enroll at a younger age, you might get a better rate increase or lesser rate increase than somebody who came in at a higher age. Okay? The next one down, the S and the Z, that's really important in this part of the state. The S means it's a statewide rate. So no matter where you live in Iowa, this is the base rate. Okay? If it has a Z, that means it's based upon the zip code that you live in. And unfortunately, this county doesn't have the largest population in the state, right? Where is it at? Des Moines. So the rate in the book is the Des Moines rate. So it at least gives us a ballpark. So we may be higher or lower in Woodbury County. But it gives you an idea. And if you're from Nebraska or a different state, you're going to have different rates anyways because of the state insurance department there. Okay, so that Z means that's not a secure rate. It could be higher or lower, but it gives you at least an idea for a starting place. The dollar sign with amount by it, if it has an amount other than 0, that means once a year they tack on an administrative fee. So that, let's see, the AARP does not. Going down to that second page. Okay, American Family tacks on how much once a year?
$20.
$20 once a year. Why they didn't put it in their premium, I don't know. But they tack on a $20 fee once a year. Now, notice in the comment section, it says there's a waiting period for pre-existing conditions for some of the plans. Remember what I said about waiting conditions for you?
For 63 days.
If you get it during that guaranteed issuance time, you don't have a waiting period. So that goes back to your question about pending surgeries. You will have coverage coming from one, going into the other, no pre-existing waiting period. So don't let an agent tell you you will, okay? Because you have that guaranteed issuance. Stick on that. You know, some of the agents are relatively new. They don't know all these little ins and outs, okay?
What did you say the GI stood for?
Guaranteed issuance. Now, notice that unless you have that certain period like you have right now, none of these plans outside your little period give you guaranteed issuance for any of these plans. They don't have to give you any if you miss that time period. Okay, that's why that September 1st date, making sure you have your supplement starting by September 1 is very important.
So how do we know what to choose, whether the raises are according to your age or whether it's across the board?
Okay, what I tell people, that's a great question. She asked, how do we know how to choose? I would say go through the book. You're going to look at the rate for the age you are, and if there are any rates above the age you are, see how much increase there is. Okay, kind of gives you an idea of how fast it goes up. And that's the current rate for these ages. That's not the rate 5 years down the road. I don't have my crystal ball. I don't know that. Okay? Find 3 to 4 companies that look like possibilities. Call the company. There's a number over here. They're going to try to enroll you over the phone. Don't do that. Ask for a number of a local agent and have that local agent come and visit with you. If that agent is an independent agent, ask him to bring 2 or 3 quotes. He may know of a couple companies that are going to undercut the one that you have. They may be those zip code related rates. Okay? And that's a way to find out. And then get those quotes from those agents and make your decision. Now, if you turn back to page 24, the page of questions to ask your agent. I'm going to have you add a couple more to it. Okay? Most of those are based on what's my exact rate going to be. You want that quote. You don't want a ballpark figure like the book. You want to know for you specifically what is your rate going to be. And you want to ask for as many discounts as possible. Okay? So some of them in there are, am I a female? Do I get a discount for being a female? Now, why do females get a discount? That's because we live longer, we pay longer. Right? Right. Okay. Why do non-smokers get a discount? Typically healthier. Less chance of the lung cancer. Okay? Also ask if they're going to give you a discount if both you and your spouse are buying. Because we've got a lot of couples in here. Check to see for spousal discounts. Okay? Questions on choosing a supplement. You feel pretty armed? This is something you have to do by visiting with agents. Okay? Okay.
Chris,
Yes.
can I say something really quick?
Yes.
The letter that you received from the district, you'll want to take that when you go and see your agent. Because that letter is that shows that you get that guarantee of issuance, or is that correct?
It shows that creditable coverage and that your insurance is ending.
I've had some that had to get another letter. They did not, some companies did not accept that letter you received about 22 weeks ago.
Right, and if
Yeah,
they
you
don't,
know
there's some of those agents that do accept that letter, because from my understanding, as long as it's got the date and your name on it, it should work. If it does not, and your agent would like something else, please call me. My number is on that letter, and I can do another letter for you that is more detailed.
Okay. And if you only got one letter for you and your spouse, and you need a second one for your spouse, again, contact Stephanie for that. Okay? So I'm going to reiterate what Stephanie said. You need to keep this letter. You need to show it to your supplement agent. You may want a copy of it. So don't give them the original. You might want to make some copies of that letter. Okay? They may ask for an additional letter that shows that you have creditable coverage. That's coverage that's at a high standard. And the school has that. You just need to prove that you had that high standard of coverage. So ask Stephanie for that. And if you need those letters for your spouse as well, contact Stephanie. Okay?
Stephanie's with the district?
Yes, and her number is on that letter. She's with the HR department. She's the one who signed it. Lucky girl. Okay, we're going to talk about Part D plans. Now, the school provided you with a wraparound with the plus plan. You all chose already a private drug plan. So at this time, you will not be changing your drug plans. You keep what you have at least until fall. So you don't have to talk to the agents about drug plans when they're coming to you. In fact, if an agent brings up another type of insurance that you didn't ask to talk about, that's illegal. Okay? Now you may throw it out there, would you also like to look at drug plans? No. Okay, and he cannot continue or she cannot continue to try to sell you something else. If you ask them specifically to come over about supplemental insurance, they're not supposed to be talking to you about life insurance unless you ask about it. That's your right. So don't let some guy get his foot in the door and then try to sell you the whole ball of wax. Okay? Drug plans are all private. So you have your choice between those. And I never want to hear in a room that because this young lady here chose this great plan, that he chose it too, based on her opinion of that plan. Because these two people don't take the same medicine. They may not even use the same pharmacy. So they may need two different drug plans, or even a husband-spouse, husband-wife. You may need two different drug plans to cover you the best, okay? When you look at drug plans, you want to look at not only what the cost is for that drug plan. So I hear some people say, I'm going down to Walmart, I'm buying that Humana Walmart preferred plan, it's only $18.10 a month. Yeah, it has a low premium. But do they realize it has a $325 deductible? And it may not cover their medicines well. Now, it's not saying it's not a bad plan, because for some people it's a great plan, but not everybody. Okay? So we can do comparisons for you as a shift count office, as shift counselors. Harvey's been doing it since 2006 when drug plans came out, before he was even trained as a shift counselor. He's a good guy. Okay? He wants to see all of you. And let me tell you, 2 years ago during open enrollment, Harvey and I saw clients. We saved them $86,000 by getting them into the right drug plans for the meds they took. That's an amazing amount of money.
I stress that it's so important. Do a comparison. You have nothing to lose. When you find out that the plan you're in is the best plan, then you know it. It doesn't cost anything. I think it's very foolish if you do not do a drug comparison with us each year.
Absolutely true. That drug comparison every year is very important. And if you're already in the plan that's saving you the most money and fits your medicines the best, we'll tell you that. We don't sell insurance. Doesn't make any difference to us if you decide to change or not. But if we can find you an option that saves you a couple hundred or a couple $1,000s, like I said, I don't stand out in the middle of the street throwing money down it. Why should you? You work too hard to throw it away. Let's get you into what fits you. So we look at all these factors, and these factors can change every year with your drug plans. When you pick up your supplement is a contract between you and that supplement company. As long as you pay the premium for the supplement, it can never change. It can never go away unless the company goes under. Okay?
That's what I thought about this one.
Well, yeah. That's why I added that little piece there, because I don't normally say that. Okay? Typically, when you have a supplement, you keep it for life. It's yours as long as you continue to pay for it. And even if they don't sell it anymore, you get to keep it as long as you pay the premium. Now, if it goes away, they don't sell enough plan in the future for some reason, I highly don't see that happening. Okay? Highly unlikely. But if for some reason it does go away, your insurance pool is going to go down. And you're going to have the same kind of thing here that's happening with the schools where the premiums are going to skyrocket. So you might want to consider, if the plan goes away, to do that. But if you move from here to Montana, I don't know why you do that, but move from here to Arizona, you get to take your plan with you, no matter where you bought it. Where you buy it determines which supplements you have choices of. But once you move, once you have it, it's yours. Never changes. Drug plans are only annual, so they can change these factors every single year. So that's why we encourage looking at drug plans every year. Besides that, a lot of us change medicines over the course of the year. So if you've had medicine changes, again, we want to take a look to see if the drug plan you have is the best one for you. Now, the drug plans have that dreaded donut hole. Oh, I hate that donut hole, don't you? Not anymore? You don't hate it anymore? That's right. 4 years ago, the donut hole, if you hit the donut hole, you paid 100% of the cost of your medicines. That's another change from healthcare reform. You know, we were talking earlier about some of those positive things of healthcare reform. And this is one. By 2020, that donut hole is supposed to be gone if it continues the way it is. So let's explain what happens with the donut hole. Beginning of the year, if your plan has a deductible, you pay nothing. The plan doesn't pay anything. You pay 100% of that medicine when you pick it up at the pharmacy. So that Walmart, that Humana Walmart preferred plan with the 1810 premium, or 1850 premium, you buy $325 of medicine at full price at the beginning of the year. Okay? So once you met your deductible, you enter into that initial period. And generally, it's a 75-25 split, but I don't even like to use that anymore. Do you, Harvey? Because it really depends upon the plan. If you only take the inexpensive Tier 1 drugs, some plans cover them 100% at some pharmacies. So you may not have to pay anything for your medicines if you take inexpensive generics. Okay? So it really depends on, with this here, on the pharmacy and the meds, but you pay a portions typically. Medicare at the beginning of the year starts adding up all these costs. What you paid and what your drug plan paid. That's called the total drug cost. When that reaches about $3,000, you enter the donut hole. $3,000. Okay? Then your plan pays nothing. And 4 years ago, you paid 100% of the cost. Right now, it's down to 47.5%. It's being reduced every year a little bit. Now, the question is, if the plan doesn't pay 100 or anything, and you're paying less than 50%, who's paying the rest? Think about it. When you paid 100% of the cost of the donut hole, what happened? If you had a really expensive medicine in the donut hole, and you hit the donut hole, and you have to pay for all of it, what would you probably do? You've gone through it with your husband. Okay? And some people continue to buy the medicine, but a lot of people, they stopped taking it. And the insurance, or the pharmaceutical companies weren't selling it. It's a win-win. The pharmaceutical companies are paying that 50% in the middle when you hit the donut hole. Yeah, isn't that amazing? Now do you know why there's not as many samples out there? They're already chipping in right here and paying that other 50%. Okay? Now, to get out of the donut hole, Medicare doesn't count total drug costs. They count anything your drug plan doesn't cover. So what you paid and what that pharmaceutical company paid, and just a little teeny bit, that 2.5% that Medicare paid here. And then when you hit about $5,000, your drug cost goes way down. I've actually seen people, and we were talking over here, somebody was telling me, I've seen people who hit the donut hole in January and come out in February. $3,000 MS drugs. Very, very expensive. Okay? So we get to see a chart like this that helps you anticipate if you're going into the donut hole. This is actually some Alzheimer's medicines. This drug plan had a slight premium or a slight deductible. Here's that initial enrollment period, or initial period where it's paying that 75-25%. This is their out-of-pocket cost when they're in the donut hole. And then by October, this person hits catastrophic coverage. Now, if you have expensive meds, this is what you may see. Most people have this extending all the way across, unless you have expensive medicines, okay? The nice thing about seeing this is we can anticipate if you're going to hit the donut hole, and what are we going to do then? So we can come up with some ideas to be able to reduce costs. Now, because you already have drug plans, you cannot change them now unless you want to look at a 5-star plan. Okay, and there are 2 5-star plans out there. I do have to tell you, in my experience, they rarely come up to the top as the least expensive. But if you have an expensive medicine you picked up over the course of this year, we can take a look. If one of those will save you money, we can switch you over to one of those, okay? If you do move, that opens up a time period for you to look at your drug plan. If you go into a nursing home, even for rehab, it opens up a window to look at your drug plan. And there are some people who can change their drug plans any time of the year, and those are residents of nursing homes and people who have those assistance programs out there. Now, you do not get this enrollment period because you have drug plans. If you didn't pick up a drug plan when you were first eligible, you pick up a penalty. And it's a 1% penalty for every month you didn't have it, and it stays with you for the rest of your life. You'll know when annual enrollment period hits because that's the time you get all that junk mail and all the ads come on TV saying it's open enrollment, time to look at your drug plans. You'll also, the month before that happens, get an annual notice of change. And you'll get a packet from your current drug company. How big is that packet normally? About that thick, isn't it? I have about an inch up here. Okay? Typically 100 or more pages, 100 to 150 pages of material. You can read that if you want, or you can just make an appointment to come in. It takes about an hour to do a drug plan comparison. Bring your medicines or a med list with you and your Medicare card, and we can do it for you. We can look at all the plans that are currently in Iowa. This year there are 29 drug plans. And if you want to sit and work with all those and try and find all their formularies and switch it out, you can. Or you can make it easy and just come on in and see us. It's free. Why wouldn't you do it?
They changed the time frame, the window.
They did. They moved it up a couple years ago. It used to go all the way to December 31st, and they moved it to December 7th. Can you imagine the nightmare it was over at Medicare when people waited until December 31st and their drug plan was supposed to start the next day? Yeah, so there's a window to get that processing done and people switch to the right plans.
So, excuse me, if this goes into effect in October, can we go at 2 months ahead to check out the plan? Because everybody's going to be coming in September.
Okay. Her question was the time frame for looking at your drug plans and when they take effect. Okay. This fall enrollment period is looking at the plans that begin on January 1st because they're annual plans. Okay, they're calendar year plans. So you come in on October 15th, anytime between October 15th and December 7th to have that done for your plan for next year. Okay?
The only thing is you can have a check before October 15th, but you cannot enroll into one until after October 15th. You should come out before October 15th.
Yeah, they normally come up in that first week or so of October. It's not always the most reliable during that time period. And sometimes even in that first week after October 15th, we have a little bit of problems with some of the companies and Medicare having tweaked the whole program. So this is the time period we can enroll you and take you back out if you don't meet one of the earlier criteria we talked about.
We're talking about the Medicare prescription.
Right, we're talking about the Medicare prescription plans.
If I have a prescription drug with my insurance.
No, Susan, you have a separate standalone drug plan. The city of Sioux City, or the school teachers insurance, that plus plan has what they call a wraparound. That wraparound Your drug plan pays first, and then the wraparound pays additional benefits. There are no additional benefits out in the private market. Okay, so you're just going to have that standalone drug plan. Okay, nothing else is going to pay what you currently had with the school system. That's why it said if you have a plus plan and expensive meds, you may not see the amount of savings that somebody with the lower cost meds will have, because you may hit the donut hole and you don't have that additional coverage.
My insurance agent quoted me pricing so much more if I added the drug coverage to it.
Right. Okay. You can buy your supplements and your drug plans from the same company, but rarely do we find that's a good option. Okay. So buy your supplement from your supplement agent. Come into us to look at your drug plan, and we'll look at all of them. Because the supplement agent has a vested interest in the companies he's selling. He's going to try to sell you the same drug plan, but they may not be a good fit for the medicines you take. If they are, we'll tell you, okay? And say, I'm looking at this. Well, how's that one compare? And most of the time, if we didn't give it to you in your top 3 or 4, it's down a lot deeper in terms of cost. And when I say deeper, that means more expensive. Okay? When we look at the cost of those, we're looking at the premiums for the year, plus your co-pays for the year, plus if the plan has a deductible, we add all those together. Okay, so we get a total cost, not just looking at the premiums or those little pieces separately. You can compare plans yourself if you want to. I mean, it's on the Medicare.gov website. This is what it looks like. We're trained to use it. We know how to get in and out of different places. There is a tutorial online, so if you like doing that kind of thing, you can take a look. You can bring it to us. You can put in your meds ahead of time if you want to, and then come on in and we'll take a second look for you, kind of like the H&R Blocks does with people's taxes, you know, and we don't charge for that. If you're going to do a comparison, this is the button you push, okay? If you're a vet and you use the VA for medical services, you don't have to have a drug plan. You don't have to pick that up at all. You have what's considered creditable coverage, okay? You can have one. You'll never have a penalty. So you have one year, drop out of the next year, come back the following year. Makes no difference as long as you have that VA coverage, okay? If you have TRICARE, and we had a couple people yesterday's presentation who had TRICARE, you don't have to have a supplement or a drug plan. Okay, VA, the same thing. You don't have to have a supplement if you use the VA for your medical. Okay, you do take some risks with not having a supplement in place if you're out traveling and you just have a standard illness, not an emergency, a standard illness. Okay, emergencies have to be covered. Again, we talked about doing those fall comparisons. Again, you can change to a 5-star plan once, and then again, if you fall under the assistance programs or the nursing home stay, that opens up the windows to take a look at your plan. There is a program from Social Security called Extra Help for people who have incomes far above poverty level. I believe it's almost $1,400 a month, $1,300 to $1,400 a month, and limited resources that can help with drug costs. That's that premium, the co-pays, and the deductibles. So again, if you know people who are struggling with their medicines costs, get them into us. We can help screen them for this and help them apply if they are eligible. If you have those high-cost medicines, you will make sure you're asking for samples if they have them, because the less money you put into buying your drugs on your drug plan, the more you're in delay going into the donut hole. If you have those low-cost medicines and you know you're going to be going into the donut hole during the year, especially towards the end of the year, if your work, ask your pharmacist if you can run those low-cost medicines separate from your drug plan. Some pharmacies will allow that, and some drug plans will allow that, others will not. But it's perfectly legal to do to keep those costs, those total drug costs down. Some of the companies that make medicines have assistance programs for when you hit the donut hole. So again, if you have those high costs, we anticipate you're going to hit the donut hole, we'll get you in about a month beforehand to get those forms going for when you do, to get that medicine supplied by the manufacturer if you're eligible. Okay, so we've hit that first line here. About 75% of Medicare beneficiaries choose this first line because it's more secure, less risk. But again, we're going to talk now about that Medicare Advantage. And let me tell you, Medicare Advantage salesmen are very aggressive. They make this sound like it's a pot of gold, okay? But you need to know the risk behind it. These are the plans that advertise on TV. They say you can have your Medicare health coverage and drug coverage for one low premium or no additional premium. And they say it just like that, don't they? You've heard them, okay? Again, they're called Advantage plans. Medicare considers that Part C. Part C, that's a private plan instead of Medicare. It's taking over your A and B. So it can be A and B equal C with a private company. Okay? They have a choice of whether you have the drug benefit. Now, who wouldn't want the drug benefit? Mentioned just a moment ago. Who might be buying their meds from another place? Those veterans. Okay? They may want some med coverage in case they can't get to the VA facilities, but they don't need the drug coverage. So this is an option for a veteran. It's an option for a person who has good health or a person who can't afford a supplement. Okay. I put Flow up there. That's new. Like that? You like that, Harvey? Why do I have Flow up there? Remember Flow from the TV ads? Oh, she turned you off. Sorry. She's always bundling stuff, you know? She's talking about it all being packaged together. And that's really what Medicare Advantage is about. It packages your whole health drug all into one big thing. Again, Medicare gives those dollars to the plan. So Medicare no longer pays. They don't pay your doctors, they pay that plan. That plan now is going to pay for the services you need, okay? And they operate under different rules than original Medicare. Similar rules, but different. And you can't have other insurance with them, so you can't have the supplement to pick out those out-of-pocket costs. You have to keep your A and B because it's transferring over. Okay, so you still have to pay that $104.90 premium. A lot of people on disability choose this because disability supplements are limited to page 39 in your book. So if you're under 65 on disability and have qualified for Medicare, you have 3 companies to choose from. And they're very expensive, 39. Very expensive, and they're going to be underwritten. They're going to be underwritten. So this is the base, but everybody's going to be higher than that base. They're very expensive for people on disability. They will not take people who have renal dialysis. Just won't do it, okay? And these are very area specific. So if you're considering one of these and you snowbird someplace else, like Harvey back here, lucky duck, okay? You have to look to make sure it covers you in both areas. It's going to cover emergency care if you travel, but it may not cover just that general, you get a cold and you need to go in, that kind of service, because that's not considered an emergency. With these, again, we talked about being private. They may have an additional premium. So there are 2 main companies in this area that have it, Coventry, Advantra, and Humana. Coventry doesn't have an additional premium. One of the Humana plans has a $30 premium per month. Okay, so much lower than a supplement, right? That's because you're taking on the risk, not the insurance company. Again, these have set co-pays, and we'll look at a chart there in a moment. Your providers for these in Woodbury County are limited to an HMO and a PPO. I would never, ever recommend an HMO in Woodbury County. If you go to any doctor